Hi, everyone. This is Victoria again. How are you guys doing? I hope all is well with you. I hope all is well with your family also. And I really want to appreciate you all that have been watching my video and leaving comments on there. Your comments really do encourage me. So I hope, I pray that God continue to bless and protect you guys all. Today's video, I want to come out here to share with you guys job opportunities that you can be doing living in the country, because this is one of the big thing. People, they are so scared of living the city because what am I going to be doing when I move to the country? So today I'm just going to be focusing on the healthcare system. So if you are a physician, a nurse, a CNA, LVN, social worker, whatever it is that you are in the healthcare system, this video is for you. But before I go in there, I want to share a testimony. I'm a case manager. I currently work for a health insurance company as a case manager. In 2017, I got this job to work at home in California. I used to live in California at that time. So I got this job. I did not qualify for it, to be honest with you guys. The requirement is that you have to have a previous case management qualifications that I did not. You have to be certified as a case manager. I didn't have that certification. You have to have knowledge of dialysis. I didn't have that. So just imagine, I knew it was just God opening this opportunity for me, because he already seen, he already know what situation I'll be in a few years. He already knows everything. But I did end up getting the job. Fast forward a couple of years, I had to leave California. I didn't have a choice. I just wanted to leave California. So I told my boss, I prayed and I told my boss, I want to move out of California. Is there any way that I can still keep my job? So she said she was going to talk to her boss. So she talked to her boss. She came back to me within a day or so. And she told me that, okay, they okayed you for you to move. It is God. It is God. So when I moved, I took about 2 weeks off. When I came back that same day, she was like, I have to talk to you. So my boss, we had a meeting with me, and she said, you could not believe it. After you moved, after we okayed for you to move and you moved, a new policy came out of a new policy just came out that if you live in California, you have to be living, your job is supposed to be in California. You cannot move out of California. You cannot be living somewhere else and be working for California plan. My dear brothers and sisters, is this not God? God is so wonderful. He's never too late. He's never too early. He's always on time. Look at how he orchestrated everything that I moved, then the policy came out. And sometimes I think about it, I'm like, wow, God, you are just too good. You are just too awesome. So that's how I still keep my job, and I now live in a country and I'm still doing that. As long as you have a fast internet, you can be able to do your job anywhere. So today I'm just going to share with you guys, in my company, things that they hire nurses for, or physicians for, social workers, so you can be a case manager, just as I am. So basically case management is just managing cases of patients. We call them members. So if a member calls with a complaint, we'll be able to help them with that. If a member called them that they need something, they need this authorized something, an MRI done, or any imaging done, or anything, and they need authorization and they've been denying them, we case manager come in and help them coordinate and do all those things. We also help with discharge planning if the patient or the member is in the hospital, we help with discharge planning. It's a vast things that we do, but that's just a summary of it. So another department is the utilization department. So utilization department, they normally hire the nurses. They also help, they do the claims. Claims come in from the hospitals, from the provider office, they review it, they either deny it or they approve it. So that's what the main thing that they do, utilization management. There are also other department like the nurse line. So members call the nurse line for advice. Maybe they are not feeling too good. What do you want me to do? The nurse just advise them, do assessment and advise them and all that. There's also like grievance, there's just a different department that you can work for. If you're not a nurse, you're a physician, they're always hiring medical directors, and they also have their role. The department also, that medical directors department also have their roles as a physician. That's another thing you can be looking into. If you're not interested in the healthcare system, or the health insurance care system, you can always get a job as an instructor. They are now hiring many people to teach nursing students online. Okay, so that is another thing that you can do. There's also opportunity to be a telehealth coordinator. So you'll be coordinating care between the caregiver, the patient, and the providers. So these are all things that you can, be doing. You don't have to. All you need is an internet, a fast working internet. So if anyone is interested, and you live in California, please reach out to me. And even if you do not live in California and you just need help looking at other options for you, please, I'm going to leave my email down in the description below. Please do email me, and I'm going to talk with you. I'm going to be sending you referrals so that you can check it out. And please do not think about, when you look at a job opening and you see all this qualification, you have to have this, you have to have that. Please do not just apply for it. I am that kind of a person that I see something that I think I just go for it. Okay. So do not be worried that you don't qualify for something. Just apply for it. I never had any case management certification or any case management background before, but I got the job. So do not worry. Let God, leave everything in the hands of God. Just apply. Do your part by applying and see what God will do for you. So again, if you are interested, email me. Let's talk, and I'll be able to help you. Anyway, so I'm going to end it here for today. If there is any questions, please, guys, let me know. God willing, the next video, I'm going to focus on those that, what about those who are not in the healthcare system? What are some of the opportunities in the country for them? So there are a lot of opportunities that, you can qualify for living in the country. You just have to have the desire. And I know a lot of people have been praying that they really want to leave the cities and move to a country, but because of an income, they are like stuck. So I pray that God will show you where you have to be. God will direct your path regarding income, give you ideas. A lot of things, we need ideas from God. And I pray that God give us all the ideas to make income in the country. Anyway, I hope you guys were blessed by this video. And I hope that I hope to see you guys in the next one also. Blessings.